The next bill on the calendar for the day is House File 2115. The clerk will report the bill.
House File number 2115, number 3 on the calendar for the day, an act relating to human services, modifying policy provisions, the first engrossment.
There are amendments at the desk, but if there is no objection, we'll allow the author of the amendment to speak first. I recognize the member from Rock, Representative Schumacher.
Thank you, Mr. Speaker. Members, this is the policy bill for the Human Services Committee, very similar in the way that we did the fiscal bill. We'll do this one as well. Article 1 is our Aging and Disability Services piece. We have provisions from Chair Knorr, from Representative Hansen. First is expanding the degree of qualifications for positive support analysts, also establishing a review process for those individuals who are denied long-term care services and supports, and ensuring that smaller assisted living providers interact with new cost reporting measures within the DWRS system. Article 2 is our health policy piece. Representative Zelensakar has provisions in here establishing medication training protocols for a greater number of nursing facility staff, ensuring that a greater number of individuals have access to a designated support person in long-term care facilities. Article 3 has our direct care and treatment piece, which is an ongoing conversation and with extra work going into that by some of our members to try and find a long-term solution to an issue that we just can't seem to get around here. And so we're putting extra efforts into that in the bill that we have here. And finally, Article 4 is our behavioral health piece. We work to make sure that mental health providers can function through workforce challenges and inadequate reimbursement rates, thanks to a bill from Representative Fischer and Representative Gilman. We ensure crisis services are accessible as possible by ensuring counties cannot charge their residents for accessing the 988 Lifeline, thanks to Representative Backer. And Representative Frederick had bills to clarify who can conduct a substance use disorder comprehensive assessment, clarifying the 10-day diagnostic assessment timeline, excluding holidays and weekends, and ensures that the recovery community organizations are certified by MARCO and must preserve client records when they dissolve. Thank you, Mr. Speaker, and for the rest of the articles, I would like Chair Knorr to walk through those.
I recognize the member from Hennepin, Representative Knorr.
Thank you, Mr. Speaker. Article 5 addresses the Human Services Office of Inspector General, particularly addresses illegal remuneration, which is anti-kickback. Article 6 to 8 addresses community treatment and assertive community treatment and intensive residential treatment services, recodification, and also mental health terminology updates. The last article is the miscellaneous article, which provides a way for the agency to notify nonpartisan staff when there's approval received from the federal government. That concludes the articles in our bill. Thank you, Mr. Chair.
There are amendments at the desk. The chief clerk will report the amendment.
Schumacher moves to amend House File number 2115, the first engrossment. The amendment is coded A7.
I recognize the member from Rock, Representative Schumacher.
Thank you, Mr. Speaker. Members, the A7 is a technical amendment just to clarify and get some of the reporting requirements correct.
I recognize the member from Hennepin, Representative Knorr.
Please vote green.
Any further discussion on the amendment? Seeing none, all those in favor of the amendment, please signify by saying aye.
Aye.
Any opposed, say nay. The motion prevails. The amendment is adopted. There is an amendment at the desk. The chief clerk will report the amendment.
Baker moves to amend House File number 2115, the first engrossment as amended. The amendment is coded A5.
I recognize the member from Candy, Ojai, Representative Baker.
Thank you, Mr. Speaker and members. I'm proud to bring forward this amendment today. What this is a update on the lawsuits that are kind of going around the country. So when we get our hands on some badly needed dollars from the opioid settlements nationally, the big bad players are finally making it towards the end of this line they've been putting out for a while. Purdue Pharmaceuticals. Purdue Pharmaceuticals are going to have billions of dollars in fines, settlements really coming up here, and Minnesota needs to make some legislative changes to make sure that we line this money up properly with what we've already established back in 2022 with the Attorney General's office in a very bipartisan manner. I was working on that with other members to make sure that we got our full value of the settlements. And what we have to do, members, is we have to have our claims bar released so that when pharmaceutical companies agree to give us the money that is owed to us so that we can get it to our communities and help them with trainings, with prevention, with treatment, with harm reductions, naloxone, all the things that we are doing in Minnesota. We are doing it because we've been able to get some funds from these actors and players that completely lost control here in the last really 20 years. What this bill does, members, is it aligns us up so when Purdue finally starts writing checks and sending the dollars to us here in Minnesota, we then know how to put those in the right places. Currently, 25% of these funds go to the ORAC Council, which is the Opioid Epidemic Response Advisory Council, which I am proud to serve currently on with Representative Robert Bierman. And we are working on that system where we can deploy dollars to a lot of areas around the state of Minnesota. Alongside of that, 75% of the counties and large cities get money from these settlements as well. So they are going right to our local communities and doing really good work there as well. This legislation, members, again, lines us up with the Purdue settlements as well as making sure that any future settlements coming our way will be in place so we don't have to keep doing this every time a new company sort of comes forward. So, members, I appreciate a green vote to maximize our resources so that we can get the claims bar legislation properly lined up in the bill so that when we start getting more money for these badly needed areas of our state for people in recovery and people so we teach our kids not to go that direction, we'll be ready for that. So members, please vote green on my amendment. Thank you.
Recognize the member from Hennepin, Representative Knorr.
Thank you, Mr. Speaker. Just wanted to thank Chair Baker for his long-term commitment to really addressing substance use disorder for many years in helping us understand and also continue to fight this epidemic. So with that, I ask members to vote green.
All those in favor of the amendment, please signify by saying aye. Aye. Any opposed, say nay. The motion prevails. The amendment is adopted. There's an amendment at the desk. The chief clerk will report the amendment.
Fischer moves to amend House File Number 2115, the first engrossment as amended. The amendment is coded A6-1.
I recognize the member from Ramsey, Representative Fischer.
Thank you, Mr. Speaker. This amendment is trying to address several things. First of all, it builds on a bill that's been introduced in the past by Chair Knorr, trying to address the case management issues that some of our counties are dealing with when they're contracting them out. Trying to put in some accountability so that we can make sure that we're having effective case management. And some of the other things that I have added to it to address came as a result of some problems I've seen in the system out there. And what I've added into it is also making sure that within about 6 years that all case management, instead of being contracted out for disability services, would be brought into the counties. I made sure to set this up as something that has got a long date out there because I know it's going to take a bit of work for the contracts to be over. It doesn't have to happen all at one time, but this can be scaled in a way that is affordable to the counties. The reason this is coming up is because there's been a number of issues that have come forward where it feels like the contracted case management has failed. On a regular basis, I hear from people where they've got contracted case management, their case managers are not able to guide them and offer them the advice that they need. In some instances, I've had children taking care of their disabled adult family where there's so much turnover in the case management, they've given up on the case management, and a lot of times they're doing the work themselves because the contracted case management is failing. An example of another situation where it is failing is where I've got one person where their electricity was shut off in May, and they had applied for, they were on disability services because of a traumatic brain injury. They were asking for emergency assistance to help them. They hit their case manager early on, but as of May 1st, they didn't get any help, and so their electricity was shut off. So they don't have any electricity right now. They reached out to the contracted case management, and all they get is their voicemail. They get a voicemail that then goes over and says, due to the high volume of calls, call back at another time. They are told that they have to put in an application, but the application process can't get started until they get information from their case manager, who they can't contact. Their food is going bad because they don't have a refrigerator. This is contracted case management. Another instance is where people had disability services and their waiver ended up getting canceled out because they didn't get the right forms filled out. This happened back in January, that their forms were canceled. It wasn't until April when I got involved in the process in mid-April to figure out what forms they needed to fill out. Once again, contracted case management, that is failing miserably. When I reached out to the county was confused as to what was going on. There's a huge disconnect. There's not enough accountability going on in these areas. And this is why we have to have a hard look at what's going on in the system. I will say that I do know that the Senate is having a provision going in on this. I would ask that Chair Schumacher, who I've been talking to on this issue, Chair Knorr, who's also been aware of the issue, is I will withdraw it now, but ask that they do continued conversations with the Senate on this and take a look at having something that's coming in, because I think this is a serious problem that we need to have accountability going out there. And in our earlier discussion, we were hearing about the rate exceptions. And I feel that, you know, when you've got contracted case managers working and pulling this stuff together, there's some loss in the accountability for these rate exceptions, and I feel that when you start pulling this back into the county system, that we'll have more control over that also. So I would ask both co-chairs to take a look at this and keep an eye out for it when they're meeting with the Senate. Thank you. With that, I withdraw the amendment.
Representative Fischer withdraws the amendment. There is an amendment at the desk. The chief clerk will report the amendment.
Robbins moves to amend House File Number 2115, the first engrossment as amended. The amendment is coded A8.
I recognize the member from Hennepin, Representative Robbins.
Thank you, Mr. Speaker and members. I have an amendment that would add language to the very good kickback portions of this bill that would include grants. So the governor has a proposal to deal with kickbacks. Our fraud committee put together a bill, HF2115, that also deals with that, and I think there are some other proposals dealing with kickback language around in different, moving in different policy bills. And this is very important, members, and so I hope that we can come to some form of agreement with it. While I greatly appreciate the inclusion of the kickback language that is in this bill, it's not complete. And the piece that is missing is that it doesn't cover kickbacks when it involves grants. And we had a robust discussion of our underlying bill in the fraud committee this morning, HF3043, and members raised concerns that really the fraud doesn't happen with the nonprofits because they don't provide the Medicaid services. It's really more the small businesses and the business LLC providers where this is a problem and where kickbacks have been alleged to be the biggest problem. And while that certainly is a big source of the problem, nonprofits are not immune from this, members. And we have to take it seriously. Leaving out nonprofits leaves out grants to nonprofits leaves out a huge element of this. So just to level set, in 2024, the OLA had a report just on the behavioral health division for DHS, and they said that there were more than, I believe, $58 million in grants just for substance abuse and mental health where there were problems. And that was mirroring a recommendation they had given out in 2021 where they had problems with $130 million in grants. And to bring it home a little more recently, at the beginning of this year, New Way, which is an addiction treatment nonprofit, racked up tens of millions of dollars in fraud, members, and those were grant dollars. It wasn't because they were a business, they are a nonprofit. And if we don't include the grant piece in this kickback language, we are missing a huge element. Another example of this, we talked a lot in the fraud committee about the business model of fraud. So what we saw in the Kairos fraud, which was revealed in the fall, is that was the for-profit side, and they created a nonprofit side which they ran the fraudulent billing through. So again, if we don't include grants to nonprofits, we are missing a huge element of how we need to address kickbacks. So members, I am withdrawing this amendment tonight because it didn't meet deadline. But we did hear it in the fraud committee today. And just for the record, the reason it didn't meet deadline is because we were working on this in the fraud committee all session, and we drafted our bills based on testimony where they asked us to create a kickback, a state crime of kickback. And so it came later in the session. But this is so important, members. We cannot wait until next year to get this done. So with respect to the process, I'm withdrawing it, but I ask members to please put the grant element in the kickback statute in the language when you get to conference committee. Thank you.
Representative Robbins withdraws the amendment. There are no further amendments at the desk. The chief clerk will give the bill its third reading.
Third reading, House File Number 2115, as amended.
Third reading. Further discussion. I recognize the member from Blue Earth, Representative Frederick.
Thank you, Mr. Speaker. I just want to start off by saying thank you to Chair Knorr and Chair Schumacher. It's been evident the entire year just how well they were working together and collaboratively the entire time. I want to just speak briefly about the SUD provisions within the bill. We're changing language from chemical dependency assessment to comprehensive assessment because they're also talking about mental health, and they need to see what all is going on with a person, not just from a chemical perspective, and this is the language that the industry is already using. In addition to that assessment, if it's eligible to be paid by Medicaid, we're going to have it paid by Medicaid, because someone who just got a DWI, they could have a judge saying that you need to have this comprehensive assessment, and then in state law it said that they had to pay for that, but we had the option, and we are changing with this bill to have Medicaid pay for it if that's available. Last biennium, we as a body decided to tackle some fraud that was going on within the recovery community organization space. Representative Robbins actually just hit on it a little bit. And one of the things that we did was we established 3 different certifiers in the state of Minnesota to certify an RCO to make them eligible to bill for Medicaid services. Well, it just so happens one of those certifiers wasn't ready to do that process immediately at the end of session last year. It took them about 3 weeks. But in that 3-week window, an employee of one of the organizations that Representative Robbins just named went around the state and said, hey, you can sidestep what the legislature put in place by doing this. And so what we are doing in the bill today is reducing that list of 3 different certifiers just down to 1 to help ensure the integrity of the recovery community going forward. Lastly, I just want to say that it was unexpected that I would be working with Representative Nadeau this year regarding the Priority Admission Task Force and the work there. And that work does continue. And I want to highlight that we've all heard from our county sheriffs, from our counties, from our county attorneys across the state, the need to invest in mental health, that there are people sitting in jails that need mental health supports that are not currently available. And this bill starts to address that. My hope in conference is we can find more money to not just demolish the building at Anoka, but actually build a new building so that we can get all of the people who are sitting in jails across the state done. So that is my hope for in conference. But I just want to thank the committee. I want to thank the chairs again, and I encourage a green vote. Thank you.
I recognize the member from Candy Ojai, Representative Baker.
Thank you, members. Great bill. Support the bill. Thank you.
I recognize the member from Hennepin, Representative Knorr.
Thank you, Mr. Speaker and members. This is a different bill from the initial one. This bill is a broad-reaching policy that impacts most vulnerable members in our community, from nursing homes to children in mental health crisis, and those who are waiting for the forensic placement in our state. So members, I ask you to vote green. Thank you so much.
Any further discussion on the bill? I recognize the member from St. Louis, Representative Zalesnikar.
Thank you, Mr. Speaker and members. I just wanted to thank the chairs for this committee for the policy bill. Members probably remember that last session we passed a bill to allow one support person for hospitals, nursing homes, assisted livings, and disability group homes. And in working with the departments, I learned that patient, the word was used patient, so it only applied for hospitals. So there is a new bill that's in this policy language that clarifies that resident applies for nursing homes, disability group homes, assisted living, so that all people will always have one support person. So thank you for adding that provision so we could get that taken care of. Vote green.
Any further discussion? I recognize the author of the bill, the member from Rock, Representative Schumacher.
Thank you, Mr. Speaker. Members, please vote green.
There being no further discussion, the clerk will take the roll. Members, please vote.
Together.
The chief clerk will call the name of the member voting remotely.
Acom.
Acom, aye.
Acom votes aye.
The clerk will close the roll. There being 121 yeas and 13 nays, the bill is passed as amended and its title agreed to.